I'm Mariah, and I help women with PCOS and fertility struggles move from confusion and disappointment to finally holding that positive pregnancy test. What I do is guide women step by step through the fertility journey, from understanding the right investigations to navigating treatments, and then supporting them all the way through pregnancy, postpartum, and beyond. By the end of this video, you'll understand which key hormones are needed to be tested for fertility, the best time in your cycle to test specific hormones because hormone levels shift throughout the entire month, and how to interpret those hormone results and what they actually mean for your fertility journey, and additional ways to assess your hormones beyond standard blood work. So let's dive into hormone testing, which is usually done on day 3 of your menstrual cycle. These labs give us a snapshot of how your ovaries and adrenal system are functioning and help identify patterns that could be affecting your fertility. The first hormones we're going to dive into are luteinizing hormone, follicular stimulating hormone, and estradiol, also known as estrogen. Let's break this down step by step. Follicular stimulating hormone, or FSH, is a hormone released by your pituitary gland, the small master gland at the base of your brain. FSH's job is to signal your ovaries to start maturing eggs each cycle. Estradiol, one of the main forms of estrogen, is produced by the developing follicles in your ovaries in response to FSH. Together, FSH and estrogen give us insight into ovarian reserve, basically how responsive your ovaries are and how many eggs you have ready to develop. When FSH levels are high on blood work, it can indicate that your ovaries aren't responding optimally. Your body is basically pushing harder to get the ovaries to work. We test FSH on day 3 of your cycle because that's when it gives us the clearest baseline picture of how your ovaries are functioning. So here's what's happening. At the very start of your period, your brain releases FSH to recruit follicles inside your ovaries. You can think of it like your brain knocking on the ovaries door saying, "Let's get some eggs ready for ovulation." If your ovaries respond easily, your FSH levels will be lower, and that's a good sign. But if your ovaries need a louder knock at the door, your brain will release more FSH. A higher day 3 FSH often signals that your ovarian reserve, your egg supply, might be lower than what's ideal for your age. And that's why timing matters so much. If you test FSH later in the cycle, the results won't be as accurate because FSH naturally fluctuates when you're closer to ovulation or after it. Day 3 is the sweet spot where hormone levels are steady enough to give us a true baseline. But here's the key. FSH by itself doesn't tell the full story. And that's exactly what's happened with one of my clients, who we will call CM. She was just 25, but had been trying to conceive for 3 years without success. Her FSH looked totally normal, and if her doctor had stopped there with the testing, she would have been told that everything was fine. But after digging deeper, we found out that her AMH was extremely low for her age. AMH, or anti-Müllerian hormone, is a marker of your ovarian reserve, meaning how many eggs you have left in your ovaries. It's often used to estimate whether your egg supply is high or low for your age. But here's the part that many women aren't told. AMH doesn't measure egg quality. You could have a lower AMH and still release a healthy, viable egg that can lead to pregnancy. On the other hand, you could have a higher AMH, but still struggle with egg quality or other hormonal factors that aren't optimal. So while AMH gives us insight into quantity, it's not the be-all, end-all of your fertility journey. I've seen many women with very low AMH, like my client CM, and still conceive naturally once we supported their overall health, lowered inflammation, and boosted egg quality with the right nutrients. So the takeaway, AMH is just one piece of the fertility picture. It should always be considered alongside FSH, estrogen, thyroid markers, metabolic labs, and your actual cycle patterns. Now, on the other hand, abnormal luteinizing hormone, so LH levels, can be a strong clue for conditions like PCOS. LH works alongside FSH to trigger ovulation. It's the hormone that gives your ovary the final push to release a mature egg. But in women with PCOS, LH is often elevated compared to FSH. Instead of a balanced 1-to-1 ratio, we'd expect to see ratios of 2-to-1 or even 3-to-1 in PCOS. This high LH to FSH ratio overstimulates the ovaries and drives excess androgen production, so hormones like excess testosterone. So that surge in androgen levels is what can cause many of the hallmark PCOS symptoms: irregular or missing periods, cystic acne, excess hair growth, and of course, irregular ovulation or anovulation when no egg is released. Without consistent ovulation, cycles become unpredictable, and fertility becomes much harder to track. And even when ovulation does occur, high androgens can interfere with follicle development, leading to poor egg quality and a harder time achieving and sustaining pregnancy. This is why checking LH, especially in relation to FSH on day 3, is so important. It doesn't just tell us about ovulation potential. It also gives us insight into whether PCOS might be a part of the picture, even if an ultrasound of the ovaries looks normal. Understanding these hormone patterns is powerful. They don't just explain why ovulation might not be happening. They give us the roadmap for what to do next. When FSH, LH, and other hormone markers are out of balance, it's like seeing warning lights on your dashboard. They point us towards the underlying issues, whether that's ovarian reserve concerns, PCOS, or other hormonal imbalances. And once we know what the signals mean, we can design targeted interventions. And that might look like lifestyle shifts to reduce stress and improve sleep, both of which directly impact hormone production. Or it could look like nutritional strategies to support blood sugar balance, lower inflammation, or replenish key nutrients like vitamin D, iron, or omega-3s. Medical treatments when necessary, such as ovulation induction, thyroid support, or other therapies guided by your care team. Essentially, these hormones are the traffic signals guiding your ovaries. When we read these signals correctly, they stop being confusing numbers on a lab sheet. They become a map to improving reproductive health, and that's what transforms unexplained infertility into a clear path forward. Next, let's talk about testosterone and DHEAS, two of the androgens that also play a critical role in fertility. Testosterone is produced mainly by the ovaries, while DHEAS comes primarily from the adrenal glands. These hormones are essential in small amounts for healthy ovulation and egg development, but when levels are elevated, they can disrupt that delicate hormone balance needed for regular cycles. High androgens can interfere with ovulation, reduce egg quality, and in some cases, reduce the risk of miscarriage. But the impact doesn't stop there. Elevated androgen levels can also show up in other ways, like unwanted hair growth on the jawline or the chin, thinning hair on the scalp, hormonal acne, and even mood fluctuations. These symptoms are all signals that your hormones are out of balance, and addressing them isn't about appearance. It's about improving egg quality, ovulation, and creating the best environment for a healthy pregnancy. So testing both testosterone and DHEAS helps us figure out where the imbalance is coming from, whether it's the ovaries or the adrenal glands, which is crucial for determining the most effective treatment strategy. For example, when we see elevated androgens, it's important to figure out where they're coming from, because the treatment approach can differ significantly. If the testosterone excess is ovarian origin, it's often related to conditions like PCOS, and strategies might include lifestyle interventions, supplements like myo-inositol, or medications that target the ovarian function to help reduce testosterone production. If the source is adrenal, it could indicate issues like adrenal hyperplasia or other hormone imbalances, which then may require additional testing and different interventions. By identifying the source, additional testing may be needed to rule out other underlying conditions, such as ovarian cysts, adrenal tumors, or rare endocrine disorders. So ultrasounds, repeat hormone panels, and sometimes specialized imaging or lab work can help ensure we're not missing anything. Now, talking about hormones wouldn't be complete without discussing progesterone. Progesterone testing is a bit different from the other hormones we've covered because timing is everything. Progesterone only rises during the luteal phase, that's the second half of your menstrual cycle, after ovulation has occurred. So testing at the wrong time can give us misleading results. Progesterone plays a critical role in fertility and early pregnancy. It helps prepare the uterine lining to be receptive for implantation and supports the early stages of the developing embryo. Low progesterone can indicate that ovulation didn't occur or that the luteal phase is insufficient, which can make it hard to conceive or increase the risk of early miscarriage. Essentially, progesterone is the hormone that signals your body the egg has been released, now get the uterus ready. Testing it correctly gives us valuable insight into whether ovulation actually happened and whether the uterine environment is ready to sustain a pregnancy. Timing is everything when it comes to testing progesterone. In a standard 28-day cycle, where we usually test around day 21, which is roughly 7 days after ovulation, assuming that ovulation occurred on day 14. The reason for this timing is that progesterone peaks about a week after ovulation, and testing too early or too late can show low progesterone levels. So the key to accurate progesterone testing is tracking your ovulation. This includes monitoring basal body temperature, cervical mucus changes, the LH test strips, also known as ovulation test strips, and even tracking the position and firmness of your cervix can all let us know if you are about to ovulate. These signs help pinpoint exactly when ovulation occurs, so your progesterone test captures the true peak of the progesterone rise. And if you're not sure how to track ovulation just yet, don't worry, I've got you covered. Check out my previous videos where I go into deep detail, showing you step by step how to recognize ovulatory signs and to make testing more precise. Knowing the right timing gives us the most meaningful insight into whether your luteal phase and uterine environment are ready for conception. By looking at all these hormones together, follicular stimulating hormone, luteinizing hormone, estradiol, progesterone, testosterone, and DHEAS, we can get a complete picture of what's happening behind the scenes. This allows us to identify the underlying causes of irregular cycles or fertility struggles and create a personalized plan to support ovulation, balance hormones, and optimize conditions for successful pregnancy. Essentially, we're connecting the dots so your body has the best chance to perform exactly the way it's meant to. Now, as a little caveat, it's worth mentioning that blood work isn't the only way to test hormones. Hormones can also be measured through saliva or urine testing. Saliva testing is sometimes used to look at free hormone levels, the portion of hormones that is active and available to tissues, while urine testing can track hormone metabolites over a longer period of time, giving insight into how hormones are being processed and cleared by the body. That said, I almost always recommend starting with blood work. It's the simplest, most accessible, and cost-effective method, and it gives us a clear snapshot of circulating hormone levels that we need to make informed decisions. Once blood work identifies potential imbalances, saliva or urine testing can sometimes be used as an additional tool to fine-tune treatment. But for most women, blood work is the best place to start. So here's the truth. Most women aren't struggling with fertility because it's unexplained or idiopathic. The real reason is often simpler. No one has ever run the right labs or looked beyond the standard normal ranges. Many labs have wide reference ranges that may technically classify a result as normal, but that doesn't mean it's optimal for fertility. So by digging deeper, checking the right markers, and understanding the ranges that matter for conception, we can uncover hidden issues that might have been silently affecting ovulation, egg quality, and implantation. If you're ready to advocate for your fertility, I created a free PCOS pregnancy prep guide that walks you through which lab tests to ask, how to track ovulation accurately, and the nutritional foundations that matter most. And you can grab all of these resources using the link below. It's completely free and will give you the clarity you need to take your next step. And tell me in the comments, which of these labs have you had tested and which are you realizing might be missing? And remember, your fertility journey isn't unexplained. It's just waiting to be investigated further.